This presentation will explain about the indications before implant placement. Before I start with the indications, this is the outline for your reference. The goal of dental treatment is to restore the patients to normal contour, function, comfort, aesthetics, speech, and health, regardless of the atrophy, disease, or injury of the stomatognathix system. Many patients who are partially or fully edentulous are better served with tissue-integrated prostheses, rather than other classical forms of therapy. However, not all patients can or should be considered for this procedure. The first step in the clinical protocol is a thorough medical and dental evaluation to screen out those patients who can be better served by an alternative treatment modality. Therefore, a thorough understanding of the indications and contraindications of implant-supported prostheses, intraoral implant, is mandatory for the success of the treatment. The general concept about indication for implant is applied to all patients who can undergo minor surgery under anesthesia can undergo implant treatment. Although it is suggested that surgical treatment is difficult in people with diabetes, those with a stable blood glucose level can undergo implant treatment. All healthy patients without underlying medical problems are successfully indicated for implant placement. Dental implants can successfully restore all forms of partial edentulism and complete edentulism. Generally, any edentulous area can be an indication for dental implants. A decision has to be made whether it is a good idea based on the patient's requirements and expectations, the amount of additional procedures required, the doctor's skill level, and the long-term prognosis. It is generally a good idea to assume that a toothless area can be considered a future implant site. However, a thorough evaluation will help give better insight as to whether alternative, more conventional treatment options would be a better choice in each. Here are some situations when dental implants are strongly indicated. Single unit toothless gap with healthy adjacent teeth. When a single tooth is missing, an implant-supported crown will preserve the adjacent natural teeth by avoiding the need to prepare them. If the toothless gap is restored with a traditional dental bridge, both adjacent teeth will have to be prepared. This operation involves permanently removing parts of the teeth's original structure, including portions that might still be healthy and structurally sound. It has always become the choice if patient cannot tolerate with removable partial denture. It has been shown to retain longer than bridge, able to keep the bone and gum tissue at satisfied level. More importantly, it doesn't require cutting of the adjacent teeth, therefore preserving the adjacent natural teeth. The decisive aspects whether a single tooth implant is indicated or a fixed dental prosthesis is preferable are related to the condition of the adjacent teeth and the neighboring anatomic structures. Decayed or filled adjacent teeth and those in need of recontouring in form and/or color, insufficient mesial-distal space and unpredictable outcome of the soft tissue contour in the aesthetic zone are clear indications for a conventional fixed dental prosthesis. On the other hand, sound tooth structure of adjacent teeth, converging root alignment, sufficient bone quantity and thick soft tissue quality are good predictors for a successful implant therapy. Other situations when dental implants are strongly indicated is in partially edentulous case. Partial edentulism with the posterior tooth missing imply the absence of several posterior teeth, molars and/or premolars, on one or both sides of the dental arch. In these cases, traditional dental bridges are difficult to design because the back support tooth is missing. Removable partial dentures generally require the preparation of more teeth. Implant-supported prostheses, although entailing a higher cost, are highly indicated in these clinical situations. A major indication for implant placement is the free-end situation when removable appliances should be avoided. Another important indication is given in the reduced dentition, when the risk of long-span fixed dental prostheses should be minimized, especially when abutment prognosis is compromised. Abutment teeth may be classified as questionable due to advanced attachment loss in periodontal cases, persisting apical lesions in endodontically treated teeth or prosthetic impairment with reduced tooth structure and insufficient ferrule. While maintaining a questionable tooth in a given situation may be reasonable, including this tooth as decisive abutment in an fixed dental prosthesis would increase the risk for failure of the entire reconstruction. In the partially edentulous case planned for a removable appliance, additional retention can be derived from implant abutments. Implants used as additional retainers of a removable denture prosthesis facilitate an increase in prosthesis stability and retention, and aid in enhancing the patient's comfort when the extension of the prosthesis bases can be reduced. Last but not least, dental implants are also indicated as in fully edentulous case. Especially in restoring the edentulous jaw, it is important to evaluate and specify the patient's desires and expectations related to implant therapy, which may vary greatly. In the edentulous mandible, for instance, a majority of patients suffer from poor retention of their existing complete denture and just expect a better prosthesis stabilization, which can be derived from two interforaminal implants and a combined implant retained and soft tissue supported overdenture prosthesis. Implant-supported prostheses solely are indicated for patients suffer from recurrent sore and pressure spots on frail soft tissues and benefit from solely implant-supported prostheses. Especially in the edentulous maxilla, some patients refuse to consider complete denture status when transitioning from partially edentulous state to edentullism. Fixed restorations are also preferred, when an increase in comfort similar to those given with the natural dentition is desired. Facial support plays an important role in patients with advanced alveolar bone resorption resulting in a retrognathic appearance of the maxilla. The need for compensation of a concave profile or prognathism with a prosthesis flange is decisive for a removable prosthesis rather than a fixed restoration. Advantages and disadvantages of the recommended therapy and treatment alternatives, including non-replacement, are explained to the patient. Costs, efforts, expected outcome, possible risks and complications, long-term results, and maintenance efforts including their own responsibility in treatment are described. And the final treatment decision is taken with consent of the informed patient. There are numerous protocols, recommendations, and educational material to properly inform the patient about implant treatment, the associated risks and possible complications. Dental implants can successfully restore all forms of partial edentullism and complete edentullism. If there are no general or local contraindications, implant-supported dentures are the method of choice in rehabilitating all types of toothless gaps.